You suddenly feel your blood pressure has spiked, you see a high number on your monitor and fear hits instantly, but today I'm going to show you how to respond calmly, step by step, to bring it down safely from home and, most importantly, avoid the mistakes that can make things worse. The monitor beeps, the sound stops, and the number on the screen feels like a verdict. A high reading. Your stomach tightens, a wave of heat rises through your chest, and your throat feels tense. Your mind jumps ahead and starts imagining the worst. A heart attack, a stroke. The immediate instinct is clear: rush to the emergency room. You grab your keys, you feel the urgency to move, to do something right now. But let me tell you something important. In most cases, that impulsive reaction, that panic, is exactly what can harm you the most in that moment. Even that rush trip could work against you. I'm Dr. Gabriel Mina, and in the next few minutes I'm going to clearly explain what's really behind those sudden spikes in blood pressure. But not only that, I'll also guide you step by step through the techniques you can safely use at home to help control it. And most importantly, I'll tell you exactly when you truly need to worry and seek emergency care without hesitation. Stay with me because understanding this can completely change how you handle these episodes, and above all, how you face that fear. And before we continue, let me make you a quick invitation. If this kind of content helps you better understand your health, subscribe to the channel and turn on notifications, because here we share clear, practical information that can truly make a difference in your life or in someone close to you. Now, let's talk about that fear you feel. It's intense, it's real, and it's completely human. No one teaches us how to react when the body sends such a powerful signal. For years, we've been led to believe that seeing a high number on a blood pressure monitor means the start of an imminent catastrophe, but the medical reality is far more complex and far more reassuring than you might think. The key is not to ask yourself, how do I bring this number down right now at any cost? That question usually fuels anxiety. The right question is, what is actually putting me at risk in this moment, the number or my reaction to that number? This brings us to a fundamental concept I want you to clearly understand. There is a huge difference between what we call a hypertensive urgency and a hypertensive emergency. They may sound similar, but in practice they are completely different situations. Imagine you have two types of alarms in your home. One goes off with a little smoke, like when toast burns. It alerts you, but it doesn't mean the house is on fire. That's an urgency. The other alarm activates only when there are real flames, intense heat, immediate danger. That demands urgent action. That's an emergency. When we talk about a hypertensive urgency, we mean elevated blood pressure, even very high numbers, but without signs of damage to vital organs. It's like that smoke detector. It warns you, but you're not in immediate danger. In these cases, the goal is to lower blood pressure gradually, calmly, and follow up with your doctor. A hypertensive emergency, on the other hand, includes clear warning symptoms: strong chest pain, severe shortness of breath, weakness on one side of the body, confusion, or a sudden, intense headache. In those cases, immediate medical attention is essential. I explain this because in most situations at home when you get scared by a high reading, you're dealing with an urgency, not an emergency. And in that scenario, your worst enemy is panic. When panic takes over, your body activates a defense response. It's as if your brain believes you're in immediate danger. Your arteries tighten, your heart rate increases, and your blood pressure rises even more. It becomes a loop. The number scares you, and the fear pushes the number even higher. I remember a 62-year-old patient who came in very distressed because of high readings at home. Every time he measured, he became more anxious, checked again, and the numbers kept rising. When we looked closely, we realized it wasn't just the pressure. It was his emotional response fueling the problem. Once he learned to calm himself and measure correctly, his readings began to stabilize. Today, we're going to break that cycle. You're going to learn how to calm that internal response. But first, we need to clear up some common misconceptions that people rely on in moments of fear, and that can be more dangerous than the spike itself. When panic hits, we look for quick, automatic solutions. That's when myths appear, advice from others, home remedies, or practices that seem logical but aren't safe. One of the most dangerous is the idea of a quick pill under the tongue. Many people believe this will instantly lower blood pressure. But what actually happens is rapid, uncontrolled absorption. Lowering blood pressure too quickly can be risky. It's like slamming the brakes at high speed. The body can't adapt, and blood pressure may drop too fast, reducing blood flow to the brain, heart, and other organs. This can cause dizziness, fainting, and dangerous situations, especially in older adults. That's why current medical recommendations are clear. Avoid these practices. The goal is not to lower blood pressure at any cost within seconds, but to do it safely. Another key point is understanding that your monitor doesn't always reflect reality if it's not used properly. Many so-called crises are actually inaccurate measurements. The cuff size matters. If it's not correct, the reading can be misleading. Your posture also plays a role. Sitting incorrectly, crossing your legs, or placing your arm improperly can artificially raise the result. And something many people overlook: timing. If you've just been active, had coffee, or feel stressed, the reading won't be reliable. You need to be at rest, calm, for a few minutes before measuring. Even anticipating the result can create tension. You put on the cuff expecting a number, and your body reacts. So if you see a high reading, pause and ask yourself, did I measure correctly? Because often, the situation isn't as serious as it first appears. There's a common belief we need to challenge, that a high number always means an emergency. It doesn't. Your body isn't a machine that breaks the moment it crosses a certain threshold. Your cardiovascular system is far more resilient than you think. Think of a car engine. It can run at high speed for a while without failing immediately. It's not ideal and it needs attention over time, but it doesn't mean instant breakdown. Blood pressure works similarly. A hypertensive urgency is like that engine running fast. A warning sign. An emergency is when the engine starts to fail and clear damage appears. Remember this, because it brings peace of mind. A high reading without warning symptoms is not a reason to panic. It's a signal to act calmly, apply what you've learned, and follow up with your doctor if needed. Now, let's focus on what truly works. I'm going to share what I call the CALM protocol. This isn't magic. It's something you can do yourself, based on how your nervous system works. Your body has an accelerator, which is stress, and a brake, which is relaxation. When you see a high number, you press the accelerator. Now you'll learn how to use the brake. Step 1. Break the fear cycle. At this moment, the monitor can become a source of anxiety. Look at the number, acknowledge it, accept that it's high, and then do something important. Turn the device off and put it away. Avoid checking repeatedly. That constant checking fuels anxiety. Find a quiet place at home. Move slowly, sit comfortably, reduce distractions. Turn off the TV, step away from noise. Create a calm space for yourself. Release physical tension. Loosen tight clothing, take off your shoes, remove any pressure on your body. Sit with your back supported, feet flat on the ground, shoulders relaxed. Do something simple but powerful. Raise your shoulders as you inhale and let them drop as you exhale. Rest your hands on your thighs and relax your jaw. Even gently placing your tongue on the roof of your mouth can help calm your mind. Small actions, big impact. With this, you've already started breaking the panic cycle. Step 2. Activate calm through breathing. Your breath is the most direct way to influence your body. When your exhale is longer than your inhale, you activate a natural response that slows your heart rate and relaxes blood vessels. Use this simple technique. Inhale through your nose for 4 seconds, hold for 2 seconds, then exhale slowly through your mouth for 6 seconds. Take your time. Feel your body respond. Repeat this pattern for several minutes. Gradually, you'll notice tension decreasing. I remember a 58-year-old patient who felt intense anxiety every time she saw high readings. Just by learning this breathing technique and avoiding constant rechecking, she stabilized her episodes and regained confidence. Step 3. Add an extra calming stimulus. There's a point in your hand, between your thumb and index finger, where you can apply firm but comfortable pressure. While breathing, this can enhance the calming effect. Do it for a couple of minutes on each hand. Step 4. An optional technique if you feel stable. You can squeeze a soft ball or a rolled towel with one hand without overexerting for 1 or 2 minutes, then switch hands. This type of muscle contraction may help relax blood vessels. Step 5. The hardest and most important step. After applying these techniques, give your body time. Don't measure again immediately. Wait at least 20 to 30 minutes in a calm state. Your body needs that time to respond. During that period, stay relaxed. Breathe gently, rest, avoid anything that triggers stress. Then, and only then, measure again under proper conditions. You'll likely see a decrease. Maybe not perfect, but meaningful. And that's what matters. You've stepped out of the danger zone. Now, there's something you must clearly understand. There are situations where you should not wait. If high blood pressure is accompanied by certain symptoms, this is an emergency and requires immediate care. Strong chest pain, severe shortness of breath, weakness on one side of the body, difficulty speaking, sudden confusion, an intense and unusual headache, vision changes, or sudden severe pain in the back or abdomen. In those cases, do not apply any at-home protocol. Seek emergency medical help immediately. Knowing these warning signs isn't meant to create fear, but clarity, so you know when to stay calm and when to act fast. We've covered an important journey together. You moved from fear to understanding what's really happening in your body. You learned to distinguish between manageable situations and true emergencies. And most importantly, you now have a clear plan to act without panic. Remember this key idea. Lowering blood pressure in the moment is possible, but it doesn't come from a miracle solution or an instant pill. Your most powerful tool is your ability to calm your nervous system. You can directly influence how your body responds. And that changes everything. But I also need to be honest. This protocol is like first aid. It helps you in the moment, gives you control, but it doesn't solve the underlying issue. Hypertension isn't fixed in minutes. It's managed over time with consistency and a proper plan. The real solution is long-term. It's in your daily habits, healthy eating, regular physical activity, maintaining a healthy weight, moderating alcohol, avoiding smoking, and something often underestimated, managing stress. Don't wait for a crisis to practice the breathing technique you learned today. Make it a daily habit, morning and night. That consistency trains your body to respond better and become less reactive. I remember a patient who lived in constant fear of checking her blood pressure. Every time she did, her anxiety increased. We started with something simple, daily breathing, no crisis needed. Weeks later, not only did her numbers improve, her peace of mind did too. She felt in control again. And that's what I want for you. If while watching this video you thought of someone close to you, a parent, a friend, someone going through this, share it with them. It could help them avoid unnecessary fear and make better decisions in a critical moment. And let me emphasize this as a physician. This information is a guide, not a replacement for personalized medical care. It's essential to talk to your doctor and build a plan tailored to you. If this content helped you feel more informed and at ease, subscribe to the channel, leave a comment, and turn on notifications. Every day we share practical, easy-to-apply health insights designed to support you. And before you go, I want to invite you to pause for a moment. Take a deep breath and give thanks. Thank God for your life, for your body, for the opportunity to learn and take steps to improve your health. That moment of gratitude also heals, calms, and transforms. I'm Dr. Gabriel Mina, and it's been a pleasure being with you today. Always remember, control the fear, don't let a number control you. On this channel, we're committed to your well-being, helping you build better habits and live with greater peace of mind. Tomorrow we'll have a new video created just for you, to keep moving forward step by step in your health journey. I'll see you there. Take care.